On February 14th, Egypt informed the WHO that a Chinese national had tested positive for COVID-19 at Cairo International Airport. It was the African continent's first confirmed case of the virus. The WHO issued a dire warning.
The best advice for Africa is to prepare for the worst and prepare today.
From there, it spread very quickly, and within a month had been detected in almost half of the continent's countries. South Africa was particularly hard hit, and the government there is taking some of the region's toughest measures.
The nationwide lockdown is necessary to fundamentally disrupt the chain of transmission across society. I have accordingly directed the South African National Defence Force to be deployed to support the South African Police Service in ensuring that the measures we are announcing are implemented.
The lockdown is being strictly enforced. Like a nation heading to war, South African President Cyril Ramaphosa ordered 3,000 troops to enforce the rules.
I have confidence in the people of South Africa that they are going to abide by the restrictions that we have placed on their lives.
But within hours of the lockdown coming into effect, there were complaints about police brutality, and thousands were arrested for flouting the rules. Some say it's the best way to keep people off the streets.
I think the minimum force should be implemented because people, they don't listen. I mean, besides people coming here to buy, there are people who are still drinking, there are people who are still roaming around the streets.
But for others, the street is all there is. Officially, there are about 200,000 homeless people in South Africa. In Cape Town, the government has built a temporary shelter to keep as many off the street as possible.
They lock us there just because of this sickness called corona. They say it's gonna kill us, but we don't know corona. But they are avoiding troubles about this sickness, so they lock us into one place.
And almost 14% of the population live in informal housing, often without basic services like running water, sanitation, or electricity. In Khayelitsha, a densely populated township on the outskirts of Cape Town, hundreds of thousands live in close proximity. In such communities, social distancing and proper hygiene are extremely challenging.
Ons probeer om te binne sit in die hokkies en maar ons kan nie. Sy moet uitgaan. Water daar gaan skep, terugkom. Sy het nie 'n kersie. Sy moet 'n kers gaan koop daar so gou en terugkom. So.
The closed borders and businesses are also putting enormous pressure on an economy already in recession. The stock market lost all the gains of the last 7 years, while the rand sunk back to a 4-year low. And the lockdown threatens the livelihoods of thousands working in the informal sector. For many of them, if they don't work, they don't eat.
Ibhisimisi phela sekusho ukuthi ibhisimisi ifile. Phandle kokuthi mina ngijampa umlayo umthetho njengokuthi namuhla yangibona ngijampile umthetho angithi yangizwa ngithi ngibuye emfinweni. Akuvumelekile phela lokho. Ngiziyeke. Yabona. Nokuthi ngizohlala la akuvumelekile.
Still, the government is determined to flatten the curve. More than 60,000 people have been tested for COVID-19, and 67 mobile testing units have been deployed, including drive-through centers. The country says it will soon reach its target of testing 30,000 people every day. The measures are strict, but necessary to avert a public health disaster.